I'd like to show you this model of the pelvis before we look at the dissected cadaver, to point out some foramina in particular through which structures that are in the pelvis exit the pelvis to go to either the gluteal region, the perineum, or the medial thigh. So first I'm going to point out the obturator foramen. This is the obturator foramen, and you can see in this model it's almost completely closed off by the obturator membrane. This is the obturator canal, and the obturator nerve, artery, and vein pass through the obturator canal in order to get to the medial thigh. I'm going to rotate the pelvis posteriorly, and we can see two foramina here, the greater sciatic foramen and the lesser sciatic foramen. They are formed by the greater sciatic notch, the lesser sciatic notch, and two ligaments, the sacrotuberous ligament, you can see attaching to the ischial tuberosity, and the sacrospinous ligament that attaches to the ischial spine. So structures from the pelvic cavity, or the true pelvis, will pass through the greater and lesser sciatic foramina to get to the gluteal region and to get to the posterior thigh and the perineum. Let's look at those foramina from an internal aspect. How's that? Or should I tilt it? Is that good? So here's the greater sciatic foramen, lesser sciatic foramen, and I'll show another angle in a minute. Sacrospinous ligament, notice it's triangular, attaches to the ischial spine, and then we say the sacrotuberous ligament. This model is great because it's held, the two halves are held together by magnets, so I can just pull it apart. Which side should I use? The left side? You can answer me.
Left.
This is the left hemipelvis. And this is how we're going to view the cadaver, because a hemipelvectomy was performed. So here's the obturator foramen with the obturator membrane, obturator canal. This is the superior-pubic ramus. Here's the greater sciatic foramen, lesser sciatic foramen. Sacrospinous ligament to the ischial spine, sacrotuberous ligament to the ischial tuberosity. If you're wondering, well, what is this up here? This represents the inguinal ligament, and I'm not going to talk about that in this video. On this bisection, you can see this is L5, vertebral body. This is the disc between L5 and S1. This is S1, vertebral body. This is the sacral promontory here. And you can see the sacrococcygeal kyphosis. That's a primary curvature. If I turn it like this, we can see, I hope you can see, if I tilt it like this, the ventral sacral foramina, and there should be 4 pairs of sacral foramina. These are for the ventral primary rami to emerge through, and for the lateral sacral arteries to enter. So the ventral primary ramus of S1 would emerge through the first one, S2, S3, S4. This ligament here is the anterior sacroiliac ligament, and that reinforces the sacroiliac joint, which is between the sacrum and the ilium. This is the iliolumbar ligament. So now we're going to go to the cadaver, but let me just remind you, a hemipelvectomy was performed. So we're going to be looking at a sagittal cut just like this model, and we're going to be looking from inside out or medial to lateral. and see the arteries, the nerves, and the muscles. So this is the cadaver, and it has undergone a hemipelvectomy. To the left is the abdominal cavity and the head and thorax, right? And to the right are the lower extremities. So right here between my hands is the true pelvis. This is the sacrum bisected right here. Here's the pubic bone. It was bisected as well. This is the bladder, also bisected. And you can see the urethra right here. This is a female cadaver. And this is the vagina. This person had a hysterectomy, so there's no uterus. So this is the vagina. This is the urethra, and this is what's left of the rectum. So I'm going to point out the vessels. This is the abdominal aorta bifurcating into right and left common iliac arteries. This is the inferior vena cava. So we're going to focus on the left common iliac artery. It bifurcates into external iliac and internal iliac. This is the ureter that's crossing the external iliac to go to the bladder. If there had been a uterus with fallopian tubes and ovaries also crossing the external iliac, would have been the ovarian vessels, but they're not present. We probably removed them. So we're going to follow the internal iliac. Before I do that, the external iliac goes deep to the inguinal ligament and forms the femoral artery. So at the inguinal ligament, the external iliac changes name to the femoral artery. Now we're going to look at the branches off of the internal iliac. Now, Grant's dissector talks about an anterior and posterior division of this artery. And I'm not going to focus on divisions. I'm just going to look at the branches. And just like arteries in other parts of the body, you will commonly find variations in branching of the arteries. But remember that arteries are always named by their destination, not by where they originate. Because they're always going to go to their target organ or target area or target tissues and supply blood. So I'm going to start with this one. This is the iliolumbar artery. And I kind of think of it makes a U-turn. It branches off and then goes back up to the iliacus and the psoas major. So that direction, this is the iliac fossa with the iliacus over here. The psoas major has been removed. The next branch I'm going to point out is the lateral sacral artery. And there are usually multiple lateral sacral arteries, and this is probably maybe another one, or that might be a branch of a nerve, but this lateral sacral comes in lots of shapes and sizes, meaning that it could be a vertically running artery that has branches off of it, or it could be multiple arteries. and maybe we'll show some other examples in other cadavers, but this would be called the lateral sacral. This is the ventral surface of the sacrum. So notice it's concave, so it has a kyphotic curve posteriorly. And running straight down the middle, doesn't look straight down the middle on this cadaver, but this is the median, with an N, median sacral artery. And that arises from the bifurcation of the abdominal aorta. Okay, so just to review, this is iliolumbar, lateral sacral. This branch is the superior gluteal, and the superior gluteal artery is going to leave the pelvic cavity by going through the greater sciatic foramen. And it's going to pass through the greater sciatic foramen superior to the piriformis muscle. This is the piriformis muscle arising from the ventral surface of the sacrum. So that's the piriformis, and the piriformis exits the greater sciatic foramen. So the superior gluteal superior gluteal artery is going to go to the gluteal region and supply the gluteus maximus and the medius and the minimus. Notice that this artery passes between two ventral primary rami, or not exactly. This is the lumbosacral trunk, and this is the ventral primary ramus of S1. So the superior gluteal artery is passing between those. This is the inferior gluteal artery, and the inferior gluteal artery is also going to exit the greater sciatic foramen, but it's going to be inferior to the piriformis, and it's going to supply the gluteus maximus, the medius, the minimus. This is the internal pudendal artery, this small one. The internal pudendal artery is going to exit the greater sciatic foramen, inferior to the piriformis, along with that inferior gluteal artery. And then it's going to take a very interesting course by winding around the ischial spine and then entering, and we can't see that happening here, and entering the lesser sciatic foramen in order to provide blood to the perineum. So the internal pudendal artery is the artery of the perineum. I already pointed at the ureter here. And now I'm going to point at this one. You see that one? This is the umbilical artery. And the umbilical artery has superior vesicle arteries arising from it. And usually it's multiple. I'm showing you one, superior vesicle. And the superior vesicle arteries supply the bladder, and this is the bladder. The umbilical artery will continue, and I think this one might not be fully intact. The umbilical artery will continue, and it will be obliterated, meaning it'll just turn fibrous, and it's called the medial umbilical ligament. And if you're able to, and you could follow it on the anterior abdominal wall, it would go to the umbilicus, or the umbilicus, or the belly button. Okay, so some of the visceral branches of the internal iliac are gone, so I'm not So so do they have the obturator artery that comes over?
Oh, wait, hold on.
No, they don't.
Let me see.
Okay, I'm going to point out the ventral primary rami and the lumbosacral trunk. So let's start with the lumbosacral trunk. Well, what is the lumbosacral trunk? It is formed by the inferior part of the ventral primary ramus of L4 and the ventral primary ramus of L5. So I'm going to show you, here's the lumbosacral trunk. It's already been formed. It's already been formed. So if we look up here more proximally, this is the ventral primary ramus of L5 right here. And then this is the inferior part of the ventral primary ramus of L4. So this is L5 that my probe is under. This is L4. And notice this craziness in this cadaver. The iliolumbar artery goes between those two right before they join to make the lumbosacral trunk. The lumbosacral trunk is part of the sacral plexus. So the inferior part of L4 and L5 contribute to the sacral plexus. This is the ventral primary ramus of S1 emerging through the first ventral sacral foramina. This is really a nice dissection. This is S2, the ventral primary ramus of S2. Here's S3 and S4. I don't see S5. The piriformis is deep to these ventral sacral foramina. And so it can be said that the piriformis forms the bed for the sacral plexus. So to see the piriformis, you have to look in between the VPR. And the piriformis is arising from the ventral surface of the sacrum, exiting the greater sciatic foramen, and then attaching to the greater trochanter. Okay. Another nerve I want to point out is the obturator nerve, and I'm going to just reflect the bladder so you can see the obturator nerve. This is from the lumbar plexus. It's formed by L2, 3, and 4, and it passes through the obturator canal, like I showed you on the other, on the model. Now, it's typically accompanied by an artery and a vein. We don't see those, but this might be the remnant of the artery here, the obturator artery. And sometimes, and this might be a ripped obturator artery. Sometimes the obturator artery arises from the external iliac instead of the internal iliac, and you'll see it coming over the superior pubic ramus and going through the obturator canal. Obturator nerve is destined for the medial compartment of the thigh. Now let's look at other muscles of the pelvis. Okay, I'm retracting the bladder, and what we can see here is the obturator internus. Obturator internus is arising from the obturator membrane and the bones that form the obturator foramen. That muscle is covered by deep investing fascia, and there is a part of that fascia that is thickened and forms this arch. So this is called the tendinous arch, or the arcus tendinus, and the tendinous arch of the levator ani. And why is it called the tendinous arch of the levator ani? Is because the levator ani attaches to it. But before we talk about that, let's finish talking about the obturator internus muscle. All of this is obturator internus. And there's more of the muscle that we can't see. And it's going to exit the lesser sciatic foramen and make more than a 90-degree turn in order to attach to the trochanteric fossa of the femur. It's an external rotator, just like the piriformis. Okay, so let's look at this arcus tendinus here and look at the levator ani. So the levator ani muscle is formed by the puborectalis, the pubococcygeus, and the iliococcygeus. Let me say them again. Puborectalis, pubococcygeus, and iliococcygeus. So I'm going to show you those muscles. So if we go as far anterior as we can with the pubic bone and point here, this is the puborectalis, and that's going to make a U-shaped sling around the rectum. Then the next muscle is the pubococcygeus. So I would say this is the pubococcygeus. And then this arising from the tendinous arch is the iliococcygeus. So again, this is the tendinous arch. So puborectalis would be most anterior and medial, then pubococcygeus, then iliococcygeus. The final muscle of the pelvic floor that's not part of the levator ani is the coccygeus. So this is the coccygeus. It is exactly the same shape as the sacrospinous ligament. And if I took away this tendinous muscle looking thing, it would be the sacrospinous ligament. So that attaches to the ischial spine, and the ischial spine is right where my probe is. We can also see the iliococcygeus right here with the bladder lifted.